everyone. I'm Cara Santa Maria. I am a science television presenter and journalist and the host of the Talk Nerdy podcast and the Skeptic's Guide to the Universe. And I'm here today with this illustrious panel, so I want to go ahead and introduce everybody. I'm actually going to start on the far end here with Dr. Mary Rogers. She's a principal scientist with Abbott Diagnostics, affectionately known as the chief virus hunter, and she manages the global surveillance program. Next to her, we have Dr. Bruce McCabe. He's a global futurist who actually travels all over the world, really embedding himself into different laboratories to better understand the innovations that are going to be shaping our future. And then finally, right here to my left, we've got Dr. Andrea Bonnier. She's a licensed clinical psychologist on faculty at Georgetown, and she's really going to be kind of speaking from the mental health perspective today. So I want to start with you, Mary. I want to start by talking about where we are today, sort of in the world of diagnostics. So, what exists now and what is actually possible?
That's a great question. And before we dive into today and tomorrow, I think it helps to maybe take a step back and look at where we were. We'll go on a little journey before the pandemic, when I, like many of you, probably did not frequently use tests at home. So it was usually a situation-specific need, like maybe a pregnancy test, and you just get your answer and move on. But then once the pandemic started, we really started to find a lot more urgency and need to be testing ourselves at home. And so that really changed the game. And we started to realize how it's not just convenience, but it's also improving access to healthcare to be able to test at home. And so we realized that there's a whole spectrum of questions that come up when you need to do testing. And each of those different questions can be answered with a different kind of test. And so at Abbott, we like to have a whole spectrum of options for testing, whether it's the kinds of things that can be answered with a core lab test in a facility that does huge amounts of testing at any given time, to testing at the point of care, which would be like in a doctor's office. So you get an answer when you're with your doctor, versus something that you do at home, which could be you get your result at home, like say a COVID test, or even if you're just maybe taking a sample at home and sending it in, there's conveniences and trade-offs at each step of the testing spectrum. And so we'd like to take to heart what we're learning about at-home testing and the value of it so that we can expand on that.
Andrea, to follow up on that, speaking of COVID-19, obviously that's still on everybody's mind. I'm curious, when we think about the pandemic and diagnostic testing and really sort of our relationship and our expectations of diagnostic testing, how do you think that it's been affected by the pandemic?
Oh, it's just been a total game changer, I think, because people now have the expectation that this information is available in their homes, that they can test and gain insight right away in the privacy of their homes in order to be empowered to make the decisions that they need to make to keep their families safe and to keep themselves safe and to know how to act in the community in a way that keeps their neighbors safe. And so I think with COVID-19, we've just seen this expectation come, and I don't think it's going away. I think that now consumers are really going to be expecting the ability to test for any number of new illnesses, whether they are infectious diseases or even other types of chronic illnesses that might come back. I think now that we have this expectation, it's not going anywhere, and the science really will be able to provide the opportunity for empowerment in a way that we haven't seen before.
And it sounds like those expectations really are kind of guiding the science. So I'm curious, Bruce, from you, what do you think the future looks like in this space? Like, what can we expect, not now, but, in a little while?
I think it's one of the most exciting areas in healthcare today. It's all opportunity, all upside. What we've learned in the pandemic with home testing and diagnostics around COVID is just the beginning of a journey into that kind of a litmus test diagnostic for a whole range of diseases. So we've got new methods coming. We're getting into CRISPR-based diagnostics. I don't need to go into that technology necessarily, but more sensitive and more programmable mechanisms for home diagnostics, so we can really tailor and customize them, and we can do 4 or 5 tests at a time. So you're doing one test, but for 4 or 5 different conditions at a time. And you'll be able to do that for viruses. You'll do that for STIs. You'll be able to do that, in different contexts and do it in an affordable way. So that's really exciting. AI And what we're doing in diagnostics there is intensely exciting. So many of you in the audience might have tried AI chatbots for healthcare diagnostics. There's about 6 or 7 big ones out there today making waves. And they're the beginning of a really rich journey in what we're going to do. So think about those chatbots that do simple Q&A, text-based diagnostics. Am I sick? I feel sick, so what have I got? Back and forth Q&A, and then it might say, go to a clinic because it's serious, or you might have this. Think of that times 1,000, because your phone, your AI co-pilot for healthcare, if you like, is also reading the medical records you're choosing to share with it, listening into your conversations and doing that sort of learning process as well about your conversations with your clinician, for example. Learning from every manual ever written and published in healthcare on the subject that you're talking about, and also asking you questions to fill in its own gaps in knowledge. Like, that's intensely exciting. And another area which really gets me going is in what I would call unobtrusive diagnostics in the home. So, we're very much about not being invasive with our diagnostics, or minimally invasive. We don't like to draw blood if we don't have to. Saliva is better. Well, better than even wearables or whatever, is diagnostics that take place where we don't do anything. So our home is equipped to listen, to look at voice biomarkers. You can actually do a lot of diagnostics just based on voice intonations and patterns and how they change if you have AI listening and machine learning off the back of it. You can diagnose neurodegenerative diseases and pulmonary diseases and other things. So now add to that thermal cameras, and you can start to see a picture of your home being able to do stuff without you even having to worry about it. And I find that incredibly exciting. And there's lots of stories of things going on there which blow my mind.
And I think, Mary, to kind of piggyback these predictions of Bruce's, I'm curious, in your own research, where do you see Abbott kind of going moving forward?
Well, we'd really like to be able to offer the right test in the right place for as many people and occasions as possible. So I mentioned at the beginning that there's a whole spectrum of tests. We really want to make sure they're tailored to the needs that are out there. And so we're starting to design tests that we could have only imagined years ago. We're really running with it and trying to find what would make sense in all the different needs that are out there. So we're trying to identify what those are and build the tests to suit the needs that are out there.
Right, so sort of what are you preparing for? Because there are some global threats that you're staying out in front of.
Yes, we don't want to live through another pandemic like we just had. Yes, no thank you. So one of the ways that we're preparing so that we can hopefully make a difference is by partnering with institutions around the world to form the Abbott Pandemic Defense Coalition, which is our solution to being able to collaborate with teams positioned all over on 5 continents. We have 20 partners that we're working together with to not only sense and understand which new pathogens might be spreading out there, whether it's the new variants that we're finding for COVID or SARS-CoV-2, or potentially new pathogens that could be making people sick that we don't know about yet because tests don't exist for them. So because we're a diagnostics company, we're able to then go beyond just sensing what's out there and be able to be part of the response so that we can build an actual prototype test that will help us answer key public health questions and hopefully allow us to respond better if there is something that could be a concern.
Andrea, I want to kind of bring it around to you, thinking from the perspective of the consumer, an individual who's actually utilizing these at-home tests. It seems like the number one driver is simplicity, right? Is that really possible to get down to the most simple test?
I think that's actually where the opportunity lies, because I work with so many clients in a psychotherapy context where the uncertainty is what is so hard. And the idea of simplifying not only their ability to get results that matter to them, but also to simplify how they can now have a path forward of what that result means. I think that's where at-home testing can make such a difference in people's mental health, because because that uncertainty is what gets in the way and makes things more complicated. If it takes them 2 weeks to get an appointment to get blood drawn, if they're not sure, whether or not their insurance will cover this test, all of those things are actually getting in the way of access. And so where at-home testing can really make a difference is in simplifying that, to have an accessible test, an affordable test that says, here's where I get this, and not only can I get my results in the privacy of my home, but now I have a strategy. And I think that's where the communication has to be really clear with the test too. It's not just here's your result, but it's now here's what you do with your result. Here's how you can actually have the insight and feel more empowered, because we know that uncertainty has been a tremendous driver of anxiety. The whole pandemic has been something that has been so uncertain in such fundamental ways. And so when we think about simplifying people's health decisions, I think at-home testing can be such a good conduit for that, but we need to make sure that we really follow through with the clarity of communication, not just about the result, but about what that result means.
Right. I mean, when I think about empowerment, I think about access, I think about affordability, I think about simplicity, but I also want to know that this kind of rapid diagnostic test is valid, that it's reliable, that it's connected to the newest science, that there are experts in my corner who will guide me along the way. It's not just about getting the knowledge, but as you mentioned, it's about knowing what to do with that knowledge. I mean, that's really empowerment, isn't it, Bruce?
Yeah, empowerment's a really good word for where we're going. It's so strong and it's so positive. Probably the most significant transition in healthcare is we're empowering the patient more. But building on what Andrea just said, there's this flip side. We've got a lot to learn about how do we coach people through diagnostics when the information is complex. There are subtleties. I'll give you an example. So genomic testing, it's not strictly home-based, but the home-based kits now, right? It's very, very popular. You can do it all. You send it off. And then it comes back and it gives you a diagnostic around age-related macular degeneration. So you might go blind, right? And we don't have comprehensive treatments for this yet. Now, there's a complex mixture of heritable and non-heritable factors in macular degeneration. So there are lifestyle factors that go into the mix for whether you might get it, and there's heritable factors. Now, some people want to know, even though there's limited things they can do to stave off this outcome, and other people, we have good data now to show that a whole lot of people don't want to know. They don't even want the result. So we've got to learn a bit about the psychology of both. How do we do that sort of complex testing in a manner which is respectful of different needs? And also, how do we provide a pipeline to the right counselling and education at the right time, which I think is your field, definitely.
Yeah, that reminds me, I'm going to tell a little bit of a personal story. Recently, I was wearing a wearable, and I kept getting these abnormal heart rate alerts just over and over, even when I wasn't working out or doing anything that should have given me that alert. And finally, I made an appointment with a cardiologist. I got an echo. I wore like a Holter monitor for a week, and they looked at all of that data, and the cardiologist's diagnosis was basically, your heart is fast. There's nothing wrong with it. It's perfectly healthy and beautiful. It just beats faster than the norm. And because the parameters in these wearables have a certain cutoff, you're always going to have an abnormal heart rate. And her advice to me was, stop wearing it, But then you have the other side of the spectrum, which is individuals who are wearing a wearable, and then they realize that they have an arrhythmia. They get some sort of a signal, they go to their cardiologist, and they're like, I'm so glad we caught this when we did. And I think that's that piece that's missing when we try to talk about at-home diagnostic testing as existing in a silo. So that leads me to my next question. Mary, I would love to hear your insights on this first, but I'd like to hear what everybody has to say. Are you at all concerned about at-home testing disengaging individuals from the greater healthcare system? Are you concerned about, taking a quick rapid diagnostic test and then saying, okay, I no longer have to go to the doctor?
I think quite the opposite, actually. I think that the opportunity to test that wasn't there before could actually help people engage more. I don't think every condition would benefit from an at-home test. That's definitely clear. Like, you don't want to find out about having cancer by yourself in your home. But there are things that, there's a social stigma or a barrier that keeps people from going to the doctor to get tested for, say, like HIV, for example, where an at-home test could actually help people get diagnosed who might have otherwise been missed. So that's what I'm seeing.
Yeah, totally the opposite. I get so excited about this topic because it's not a zero-sum game. A lot of health practitioners I talk to, when they see home diagnostics for something, they feel a little bit threatened, for example, inside the system. Dermatologists, when they saw that we could do AI and take images with our phone to say, was this a bad spot that might be a myeloma one day or a good spot? They were thinking, will there be a role for me? And even radiologists were going, oh, but this is different. But they're worried about their jobs for the future. And what happens with the introduction of all of these technologies is the whole system grows. We just do more work. And a little story about the dermatology one, they're all worried about it. So there's a trial currently underway in Hungary. One of their leading medical universities has taken the app to look at spots and diagnose skin diseases. And yes, the AI does the first level, but they've integrated it with the healthcare system. So a human's in the loop, and dermatologists they've got prioritized workflow coming in. People are doing home diagnostics, but it actually goes into the health system. They're catching more diseases. Many, many, many more people are actually looking to see whether they should get a spot investigated. So the catchment has increased tenfold. The speed of service for turnaround on, you need to come and see someone because that spot's a bad spot, it's 10 times faster, 1/10 of the time. And they've reduced the entire cost of the process in the healthcare system at the same time. So it's like good, good, good. But what it's done is increased engagement with the health system, massively increased. And so there's no dermatologists out of work. They need more dermatologists, interestingly, and never in history. Never in history have we empowered the patient with technology more and seen anything other than an increased opportunity to have impact for the healthcare system as a whole. Yeah.
I mean, I see this as much more than a tech innovation. This is a fundamental social justice issue. One of the things that we sort of mentioned when we talk about empowerment, individual empowerment, is that marginalized individuals have significantly higher rates of later stage diagnoses of cancer, right? Marginalized individuals are very often diagnosed when there's less intervention to be done. And so from a public health perspective, an epidemiologic perspective, a social justice perspective, at-home testing really can help, at least to a small extent, level that playing field. It can help people get access so much sooner.
Yes, exactly. I think we're talking about really democratizing people's information about their own health and allowing people to take that into their own hands. And I agree with both Bruce and Mary so much. I think when we think about engagement with the healthcare system, what we're talking about with at-home testing is really the opportunity for more meaningful quality engagements. We know that we have a healthcare worker shortage. We know that the system is overtaxed and overburdened, and there is burnout, and there are not enough providers to go around, and that trickles down into people not receiving care. So how I see things moving forward with more quality at-home testing, people can then have the kind of engagements with the healthcare system that are more streamlined, that are more informative, that have less red tape, that allow them to actually at that first meeting say, here's what I found out, where do we go from here? Rather than, oh my goodness, it's taking me 3 weeks and 4 different appointments to even find out this information, and I'm uncertain about what to do. So I think the ability to reach populations that might have been also fearful to come in. What's the test going to be like? Are they going to draw blood? What is it? Is it going to take 2 hours out of my workday to go and get this test? You can imagine how many communities are so unable to access care purely for those reasons, that really we're talking about such an important innovation with at-home testing, because now they are empowered to at least start results. And now when I see a provider, there's not as much red tape. I can get right to it. I have this result. Please help support me in coming up with a path forward.
Absolutely. It's all about that patient advocacy, that individual advocacy. And I want to follow up with you because I'm really glad that we have this mental health perspective. You wouldn't think, right, on a panel about at-home testing, but it's so important. And, I'm a psychologist in training. Not a psychologist yet, but I work with, I'm developing a specialty in psycho-oncology and end-of-life and gerontology, and I've noticed during my experiences how important that mental health piece is to the overall medical team, right? Like the social workers, the psychiatrists, all of these supportive individuals. I cannot imagine going through what some of my patients have gone through without that mental health support. And so I'm really curious from you, from this perspective, how has bringing mental health into the conversation, kind of globally, affected this specific conversation about at-home testing?
Just the amount of conversations about mental health over the past couple of years, it's been astronomical, the growth. Organizations that would have never, ever had me come and speak about mental health, for instance, now they realize how important it is. And I like to think of it as a small silver lining of the disruption that we've had, and the tragedy of the pandemic is that people are talking about mental health in ways that they would have never before. And it's going to save lives in that regard, because mental health is health. Period. And I think the amount of growing anxiety, the amount of growing depression symptoms, we have the data. It's really, really concerning that we need to not lose sight of the human element. When we're talking about at-home testing, we're talking about guiding people through some of the biggest decisions of their lives, some of the scariest potential moments of their lives. Even for an at-home COVID test, getting that positive result, especially before vaccines, could be incredibly frightening. And I think we need to be very careful, as Mary said earlier, that we keep in mind maybe that there are certain tests that we don't use at home processes, but we should always have the mental health context in mind. And I think trust is at the forefront of that, to not lose sight of the fact that when we are asking people to entrust these tests with their most intimate and important parts of their health information, we need to really earn that trust and keep deserving that trust over and over again, because this is what makes or breaks people's lives. And when I say trust, I mean trust about the accuracy, and also trust that the decision-making going forward is going to be something that makes sense. So for instance, all of the conflicting information, I think, that's out there in a public health standpoint, it really causes anxiety. And people say, okay, I've got this positive test, but I don't know. Am I supposed to quarantine for 5 days? Am I supposed to quarantine for 10 days? The CDC says this, but I also heard this, and then my doctor says this. So I think with at-home testing, we really need to not lose sight of the fact that people really crave the support and expertise of a very trustworthy source to be able to guide them through these decisions.
Yeah, it speaks so much to the evolving role of health providers as educators, both inbound and outbound. As these tests go out, we need to be conscious of and learn how the community responds and how we respect individuals' needs and how they want to compartmentalize information or share it. And then we have to find ways of providing really good information channels for people post-test. So there's lovely staircases back into getting help, and particularly psychological help as well, especially if something is a disease you can't do much about. So there's a changing role there for the health provider, which I find interesting as well.
Yeah, and you mentioned the role of healthcare providers, and I want to kind of switch gears a little bit back to the role of these biomedical scientists. And Mary, I'm curious from you, is there anything that you can think of right now where we have this idea in our head, like, duh, that's so easy. Why don't we have that yet? But obviously, it's much more complicated. What are we working on right now that we still don't quite have in the bag?
Well, I would say something that sounds simple is collaboration and sharing information. And in truth, it's very challenging. I really think that we learned a lot through the COVID pandemic about how to do that better as a scientific community, and so I'm really hoping we'll continue with that. And in a way, our coalition is really one of our first steps towards fostering that in a long-term solution, where we're partnering with all these groups because we need to share, and really, honestly, no one group can do this work themselves to potentially stop a next pandemic. So by working together, we're trying to continue that effort that began in the COVID pandemic of really working together and sharing information.
Bruce, Andrea, I'm curious, anything that you can think of that's like kind of deceptively complicated in this space?
I just want to add to this things that are exciting, that and what's next, and because there's so many things, right? I don't want to get carried away and dominate things. I'll just tell a couple of really quick stories. I've been in a lab where people are able to use the Wi-Fi bouncing around your house to actually do health diagnostics. So initially they said, well, we can use the way Wi-Fi waves bounce off the water in people's bodies to watch their movements and whether their gait is okay and if they have a fall. And then they found out, you know what, it's pretty high fidelity. We actually monitor their breathing and heart rate, and we can do that in the background as well. Like, how cool is that? And how many opportunities does that open up? It's vast. And another one, just a little one, but it blows my mind. There's a whole new area of diagnostics on the back of this coming, and I'm sure Abbott will be jumping into. You'll have heard stories or seen stories about people who have hypersensitive smell, or even dogs that can pick up on when someone has cancer or Alzheimer's and that. So there are some people that have that ability. There's a lady in Scotland, Joy Milne is her name. You can kind of Google her and her story. And her husband got Parkinson's and unfortunately is now passed. But she could detect the difference in the odors. She knew he had something. And it turns out she was very hypersensitive. And she's been working now with the University of Edinburgh and the University of Manchester to isolate the particular molecules that she can pick up with her smell. Now they've isolated it. Now it's a matter of making a test for it that is far more sensitive than any other test. So it's an olfactory marker, a smell marker. And we're now making electronic noses or basic swab tests for that molecule. And we can do it it turns out, for other neurodegenerative diseases and cancers and so forth. So there's a whole field of diagnostics we haven't really tapped yet that are going to be home-based diagnostics. So, yeah.
I love that so much. I mean, and it's like we're here at CES, right? We're talking about innovation across the spectrum. And it sort of reminds me of all of the recent innovations that we see in astrophysics and astronomy, right? Like these whole new ways to measure the universe. We can look at gravitational waves. We could never do that before. That there are these different sensors. We're so used to thinking about like a marker in blood, a marker in urine, a marker in, a protein. We're looking for a specific reagent or using a reagent to find a protein in your saliva. But this creative approach, like how else can we get that data and look for these anomalies? It's fascinating to me. So, sorry, went a little off topic there, but Andrea, I'm curious if you had anything to add about kind of what we were talking about, this idea that there are certain things that seem so simple, there are other things that are deceptively complicated, and as the consumer, like, where do we net out? How do we make sense of this?
Yeah, one thing that immediately comes to mind is the concept of privacy. And maybe nobody thinks it's that simple, but essentially I think this is an area that has to be taken very, very seriously. And just working with people in a mental health context, part of the beauty of the work that they can do is knowing that there's a sense of privacy, that there's a sense of being able to be protected by that relationship. So when we ask people to do at-home testing, we need to keep in mind that we have to have clear answers about what happens with my results, who else gets to see them. Is my, biomedical material being uploaded somewhere? Are my results kept somewhere? Who is actually opening the package that I'm sending back in? Or is there some sort of, code here that when I scan for my results, it's going to be shared elsewhere? And I think privacy is going to be something that really does tie in with trust. It has to be at the forefront. Thinking about if we're asking people to find out information that could make or break their lives, they have to be able to understand exactly where that information is shared. And I think that's something that's going to continue to get more complicated with the technology, so we have to keep up with keeping that a priority.
Absolutely. Bruce?
I wanted to just add to that word shareability is part of this huge, probably the greatest challenge in healthcare today. It's a social challenge of integrating health records. I mean, we were talking about 20 years ago, we're going to have these health records that'll talk to other health records, unified health records, standard. It's the greatest disappointment in one of the greatest things. I've been doing this for 30 years, and it's just one of those things that hasn't happened. And I've been talking to nurses lately, interviewing them around their experiences, and every time someone presents, you start from scratch to get their medical history. It's pretty much a given you're going to start from scratch. So one of the great challenges we've got to work out socially is how do we allow someone to do home testing, all these things we're talking about, and make choices about how to share it and actually have it work.
Yeah, I would add, I mean, these are really great points. And it's really critical to maintain that trust with digital data as we digitize more tests and make them more accessible. In a way, we have to really think, and we do at Abbott, more as a test as not just the result, but the full package, how you access it and how it's used.
And speaking about, how you access it, how it's used, what the test really is, I mean, kind of a wild card question in here. I'm curious, so many of us are focused on COVID right now, right? That's at the forefront of our minds, and pretty much everybody, right? Oh yeah,
No, we're
totally,
not focused
right?
anymore. We don't want to talk about it anymore.
I'd say everybody in this room has probably used a Binax Now test, has figured out whether or not they had COVID within, 15 minutes. But Mary, what are some of the other things that maybe specific things that maybe aren't at the forefront of our mind that we can now do at-home testing for, and things that we're hoping to be able to do in the future?
Well, I think that the sky's the limit, right? I mean, especially when it comes to infectious diseases, there's a lot of other viruses, for example, that it would be really helpful to be able to test at home. There's also kind of the hybrid approach that maybe, instead of having to go all the way to the doctor's office or all the way to a hospital, you go to somewhere like a Walgreens. We just started a partnership, actually, where you can go to Walgreens and have a flu and COVID test done with our ID Now instrument, and then you could also then get a prescription if you need it. So those kinds of opportunities are becoming more and more possible. And so the future will tell what some of those might end up being, but there's a wealth of options.
Yeah, I like this idea of we've got to get away from the idea of it's binary. It's either home or at the clinic, right? And that's what you're speaking to. It could be Walgreens, could be something in the middle. Mm-hmm. And even tests, so here's an example of one. They've come up with using your phone camera to photograph inside your eye. Use the camera to do that. We can do that, and it can diagnose retinitis pigmentosus or AMD or a range of other diseases. So that's really cool. But having issued this, it turns out it's not so easy for someone to do it by themselves because you really need to dilate the iris with some drops. And so it's more devolved now to a community nurse level or a carer level, or if you're an aged care provider, someone within that system. So it's like each of these tests might exist somewhere on that spectrum of completely self-service or laboratory or anywhere in the middle. And we've got to think of the future that way, right?
Exactly. Yeah. I mean, it really also kind of depends on the kind of disease it is, too, because some make more sense to be able to do on your own versus having that extra level of potential accuracy added by having it done by professionals. So, but that's really important to make sure. We really take accuracy and reliability very seriously because that's really a foundation to any of these kinds of different types of tests. It has to work. And we have to make sure it's reliable. So as we even talk about all these technologies, it's like a really key part of it that we have to really thoroughly vet everything.
Well, we learn with various types of COVID tests, if you don't do it exactly right, you massively affect the reliability. So there's it's complex.
Right, and I love this idea, too, of kind of solving problems that actually exist, right? Not just solving problems that don't exist because we have the innovation, because we have the tech, the data. And, the kind of needs of the consumers really drive this. One of the things, for example, that I would love to see in the near future is a full at-home STI panel. We talked about, empowering individuals to make good healthcare decisions. We talk about reducing stigma. I would love to see something like that. I'm curious kind of down the line if there's any hopes, any pie in the sky. Like, what do you guys want to see in at-home testing.
You already do a dual assay test, don't you, in STIs? Is that right?
We do. We have an HIV test that can be done at home in some markets. But that's just the beginning, really. Yeah. I think there's been a lot of hesitation before COVID about doing those kinds of tests at home. And so I think this is kind of opening a door for us to make more of those kinds of things available.
Mm-hmm. Right. And I'm thinking when you can do that, you can start to change the norms too. And that's how you can protect people. Like if it becomes more normal and more seen as what you naturally typically do, what most people do, for instance, to take an STI panel before they're going to get into a relationship or before they're going to interact with somebody in a romantic or sexual way, I think that's when you're really talking about the power of these tests to really make a dent in certain public health issues. You know, you can really talk about the prevalence of certain illnesses going down because now people have the information and they can act on it. And when the norms change, then you have this exponential effect of now it becomes the default. Yes, you know, it's expected. Just like, you know, we've seen that in all kinds of ways that the norms drive behavior. And so it's really exciting to imagine that if we get to a point, for instance, where we have a panel like that and it becomes the typical thing for people to do before they go on a date or something like that, how amazing that we can help protect people and that we'll see certain illnesses go down in prevalence.
Yeah, and you know, unfortunately, we're running low on time. I feel like I could talk to you guys about this for hours. So I was hoping here in the last couple of minutes, maybe about a minute each, if there's anything we haven't covered, if there are any final thoughts that you guys have for us out here, take it away as soon as something comes to mind. Bruce, I see the gears turning.
I really see this as I want to stand back. It is part of the future of healthcare. What we're talking about here is a metaphor for the future of healthcare, empowering the patient, getting diagnostics to be more affordable. I actually see this is the only way that healthcare stands up economically. We're constantly pushing things down in cost and affordability and accessibility and simplicity, therapies as well as diagnostics, but let's stick with diagnostics. And some people see it as quite threatening initially, like if we go back to, say, Margaret Crane, you know, she invented the home pregnancy test. There was a lot of resistance because women had to go to a doctor to have that test and then had to make another appointment to get the results some weeks later. So Margaret invented this test. She changed the world. A whole lot of doctors felt initially a bit threatened. There were actually editorials in leading medical journals about why this isn't a good idea, you know, that sort of thing. But you stand back and it's making room for other treatments. It's empowering women. It's changed the world that way. It's reduced the cost and the expense of all of that activity, which has allowed higher value activity around obstetrics and other things, and their engagement hasn't decreased. So there's this constant loop, I think, of cycling things out of the healthcare system into the home or into the carer, into the less trained professional, if you like, so that we can allow new therapies which we want, which initially are very expensive, into the system.
Mary and Andrea, he took most of your time. So quickly, any other things that you guys want to add to that?
I would just say that making informed decisions about your own body and your own health care, that's what we're after. And that's what we're talking about today, is empowering consumers with insight to make choices that are going to improve their health and improve the health of their families and the lives of those around them.
And I'll be brief. I'll just say the future is bright for at-home testing. It's really exciting to see how we could move to a future where instead of going to healthcare, healthcare can come to you.
Absolutely.
Well, we didn't have the time to do a Q&A, but if any of you have questions for our panelists or for any of the experts from Abbott, we do invite you to come just straight down the stairs. You'll see the Abbott booth, and you can ask any of those questions. But for Dr. Mary Rogers, Dr. Bruce McCabe, and Dr. Andrea Bonnier, and everyone at Abbott, I'm Cara Santa Maria, and I wish you guys a happy and healthy rest of your time at CES.